Universal primary care is the starting block for so many improvements in our society. General health, well-being, the stress that medical care puts on families is unbelievable. The strain on parents, on children, on trying to work, trying to go to school, and essentially lead a normal life while you're struggling with medical conditions is unbelievable. Another really critical issue to me is we hear so much about the lack of beds and capacity in emergency rooms. And so much of the stress on emergency rooms and hospitals can be avoided by addressing illnesses early on or preventing them through routine checkups and health care, which people avoid now because of the cost. So earlier, a member of the media asked Representative Sheena about the cost of this, and I tend to look at the avoided costs, like reducing spending. Going to the emergency room is the most expensive kind of care possible. And if you could reduce emergency room visits by 10%, you're well on the way to paying for primary care. So to me, it makes a lot of sense. The mechanics of it make a lot of sense, and the need for it is fundamental. Even mainstream insurance now is so expensive that people are avoiding getting getting routine care. So the initial sacrifice is not getting the care when you need it, not following up on those first symptoms. But I also saw people really struggling with medical debt, and trying to balance heating the house, keeping the car running, paying rent, and paying off medical debt. And that increases the burden that I was talking about earlier, the pressure on families, the conflict within families. Most in a family or a relationship, many of the dynamics are about money. And this is an unnecessary burden, adding fuel to that fire.